Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi and a very good morning to all of you. Today we are going to have a practical on gross anatomy of the respiratory system. Okay, in this practical we are going to have 3 sessions. Okay, for the first session, I'm going to demonstrate on the thoracic cage and the intercostal spaces. Then I'm going to show you the diaphragm and intercostal muscles. Okay. In the second session, I'm going to demonstrate on the nasal cavity and nasopharynx, followed by the larynx and the laryngopharynx. And the third session, I'm going to demonstrate on the trachea, lungs and pleura. Now, let's start with the first session. Okay, as you know that the thoracic wall is formed by the thoracic cage and the thoracic wall muscles. Okay, so this is the thoracic cage. If you can see, anteriorly the thoracic cage is formed by the sternum. Okay, so this is the sternum. Laterally, the thoracic cage is formed by the ribs. Okay, these are the ribs and its costal cartilage. Okay, so these are the ribs and its costal cartilage form the lateral part of the thoracic cage. And posteriorly, the thoracic cage is formed by the thoracic vertebra. Okay, now the sternum, okay, is divided into 3 parts. Okay, the first part, the most upper part, the most superior part is the manubrium. This is the body, and this is the xiphoid process. Okay, and these are the ribs. We have total 12 ribs. Okay, and we can classify the ribs into true ribs, false ribs, and floating ribs. Okay, true ribs is from first rib up until 7 ribs. Why we call them as the true ribs? Because this rib is attached to the sternum via the costal cartilage. They are directly attached to the sternum via the costal cartilage. So the first, second, third, fourth, 5, 6 and 7 rib, we call them as the true ribs. Okay. Now, the false rib is formed by the 8, 9 and 10 rib. Why we call them as the false rib? Because this rib, the anterior, on anterior it will attach to the costal cartilage, but this costal cartilage is not attached directly to the sternum, but it attached to the costal cartilage above them. Okay, so this is the 8 cartilage, so it attached to the costal cartilage above them. 8 attached to the 7, 9 attached to the 8, and 10 attached to the 9. Okay, and the other ribs is the floating ribs. Okay, I move this a bit. Okay, so this is the 11 and the 12 ribs. We call them as floating ribs because basically they has no attachment anteriorly. Now the ribs also we can classify them into typical and atypical ribs. Okay, so this in the center would be the typical rib, example of the typical rib, and these are the example of the atypical ribs. Okay, and for the typical ribs is the rib 3 up until rib 9. For the atypical rib, we have rib 1, 2, 10, 11 and 12. Okay, but for this practical, I'm just going to show you the difference between the typical rib and example of the atypical rib, the rib 1 and rib 12. Okay, now let's look at the typical rib. Okay, so this would be your typical ribs. Okay, and the typical ribs, this would be the posterior surface, the posterior part, and this would be the anterior part. Okay, and here this part is what we call as the head of the ribs. Okay, and for the typical rib, they will have 2 facets. Okay, they will have 2 facets, superior and inferior facet. Okay, and if you can see, this would be the shaft of the rib and it curve anteriorly. It flatten and it curve anteriorly. Okay, this would be the internal surface, and this would be the external surface. Again, this would be the internal surface, and this would be the external surface. This would be the superior border, and this would be the inferior border. If you can see and you can palpate them as well, the superior border is more blunted, while the inferior border is more thinned. Okay. Now, if you look on the external surface, on the posterior part of the ribs, you can see this prominence, and we call them as the tubercle. Okay, between the head, this would be the head, and this would be the tubercle. This is the area, the constriction area. We call it as the neck. Okay. Now, what else? If you can see on the inferior surface, you can see this groove, this linear groove here. You can see this is what we call as the costal groove. Okay. Now, let's move to the atypical ribs. The first one would be the first rib. Okay. So this is the first rib. Okay. So this is the head of the rib. Okay, but it has only single facets. You can see it has only single facet. Compare with the atypical one, they will have two facets. But for the first rib, it has only single facet. Okay, and if you can see, the first rib is the broadest rib, shortest rib, and it is the most sharply curved rib. Okay, and what is the most significant difference is that, remember, in the typical rib, you will have the superior border and inferior border. But in the atypical rib, you will have the superior surface and inferior surface. Okay, and in fact, in the superior surface, you can see two grooves. Okay, you can see two grooves. Okay. One groove is for the subclavian vein, okay, and the second groove is for the subclavian artery. And in between these two grooves, you can see a tubercle here is the scalene tubercle. Okay. Now, another example of the atypical rib is the rib 12. Okay. So again, in the rib 12, okay, so this is the head of the rib 12. You can see it also has single facet, and it doesn't have the tubercle. Okay, it doesn't have the tubercle, and anteriorly it pointed because it doesn't have attachment to the costal cartilage. Now let's look at the thoracic vertebra. I will demonstrate the typical thoracic vertebra. Okay, so this is the thoracic vertebra. You can see this is the body of the thoracic vertebra. Okay, and this foramen, we call it as the vertebral foramen. Okay, it is bounded laterally by the pedicle and the lamina. Okay, this would be the pedicle and this would be the lamina. Okay, you can see several projections that come out from the thoracic vertebra. The first one would be the spinous process. Okay, and you can see that this projection pointed posteriorly. Okay, so this would be the spinous process. Another projection is the transverse process. Okay, you can see this is the transverse process and another transverse process that project laterally. Okay, and here this would be the articular surface this would be the superior articular facets. Okay, this would be the superior articular facets that facing posteriorly, and if I turn them, okay, you can see this would be the inferior articular facets that facing anteriorly. Now, if you see on the lateral view of the body, you can see these two articular surface. One would be the superior costal surface and the other one would be the inferior costal surface. Okay, and on the transverse process also you can see an articular surface. Okay, so now the costal surface on the body will articulate with the head of the rib, while the articular surface in the transverse process will articulate with the tubercle of the rib. Okay, now let's say for the rib 6, the inferior facet will articulate with the superior costal surface of the thoracic 6. Okay, meaning that the inferior facets of the rib will articulate with the superior costal surface or facets of the thoracic vertebra. Okay, now in this cadaver you can see the ribs of this cadaver. Okay, so this would be the second rib, third rib and fourth rib, and between this rib we call them as the intercostal space. Okay, the intercostal muscles will be located in between the intercostal space. Okay, from anterior to posterior, okay, the anterior intercostal muscle we call them as external intercostal muscle. Okay, then more posterior would be the internal intercostal muscle, and the most posterior would be, the most deeper would be the innermost intercostal muscles. Okay, if you can see here, this intercostal muscles, external intercostal muscles fiber, you can see it runs downward and forward. Okay, now I want to flip this anterior thoracic wall so that you can see the innermost intercostal muscle. The muscle fibers run downward and backward. Okay, what are the muscle that you can see here? Okay, this is the transverse thoracic muscle. Okay, transverse thoracic muscle. Okay, now let's move to the main or the principal inspiration muscles. Okay, the diaphragm. Okay, so this is the diaphragm, and if you can see, the diaphragm is basically a very thin muscle that is located in between. This would be the thoracic region, and below here would be the abdominal region. Basically, it's formed like a septum between these two regions. And if you can see peripherally, okay, the diaphragm is muscular, while in the center there would be the central tendon. Okay, and in this practical, you all please try to appreciate all the apertures that you can find in the diaphragm and the level of all these apertures. Okay, now let's start with the station 2. Okay, in the station 2, I will demonstrate on the nose, and then the nasopharynx, and larynx, and the laryngopharynx. Okay, now, here, this would be your external nose here. Okay, this would be the external nose. And the chambers within the nose, we call them as the nasal cavity. Okay, the nasal cavity have roof, floor, and also medial and lateral wall. So this would be the medial wall, or we call it, or we can also call them as the nasal septum, which divide the nasal cavity into two halves, the right and the left half. Okay, another wall of the nasal cavity. Now I'm going to flip the nasal septum so that you can see the lateral wall. So this is the lateral wall of the nasal cavity. Okay, again, this would be the roof, the floor, the medial wall, and the lateral wall. Here you can see in the lateral wall, several projections come out from the lateral wall of the nasal cavity. Okay, the first projection, the most superior projection, we call them as the superior concha. The middle one, we call them as the middle concha. And this one would be the inferior concha. This one would be the inferior concha. Now, before we proceed with the opening into the nasal cavity, I'm going to show you the paranasal sinus. Okay, not all paranasal sinus that you can appreciate in this specimen, but I'm going to show this would be the sphenoid sinus. Okay, remember, the paranasal sinus is basically an air-filled chambers or an extension of the nasal cavity that extend into the cranial bone. Okay, here you can see this is the occipital bone, and this would be the sphenoid bone. So the sphenoid sinus is located within the sphenoid bone. Now let's look at the opening of the nasal cavity. This is the sphenoid sinus opening. Okay. Now for the superior sinus, there will be an opening of the posterior ethmoidal sinus, but I cannot demonstrate it in this specimen. Now let's look at the opening that we can find in the middle meatus. Okay, the meatus would be the area that is located inferior to the concha. So inferior to the middle concha would be the middle meatus. Okay, so this one I'm going to flip to show you the opening that we can find in the middle meatus. Okay, so here you can see this would be the semilunar hiatus. Okay, you can see this would be the semilunar hiatus, and superior to it you can see a projection, we call it as bulla ethmoidalis. Okay, in the semilunar hiatus you can see several opening. One would be from the frontal paranasal sinus, okay, and then you can see an opening from the anterior ethmoidal sinus, and here you can see an opening from the maxillary sinus. So this would be the inferior concha, and the space below the inferior concha is the inferior meatus. Okay, the nasolacrimal duct will open into the inferior meatus. Okay. Now, this is the nasal cavity, and if you can see, the nasal cavity is continuous with the nasopharynx. Okay, this part is the nasopharynx. Okay, nasopharynx is one part of the pharynx. The pharynx is a structure that is extend from the cranial base here, okay, that is formed by the sphenoid bone and the basilar part of the occipital bone. Okay, so this is the cranial base. So the pharynx is formed from the cranial base up until the inferior border of the cricoid cartilage. Okay, but here you cannot see it clearly here. Okay, so this whole thing would be the pharynx, and we divide them into three parts. Okay, nasopharynx, oropharynx, and laryngopharynx. Okay, now let's focus on the nasopharynx. Okay, you can see in the nasopharynx, okay, the roof and the posterior wall is in continuation, and you can see a bit here. This would be the adenoid tonsil. And on its lateral wall, you can see a big opening here. This would be the opening of the auditory tube. Okay, and this would be the tubal elevation of the auditory tube. And posterior to this elevation, we call there is a recess. We call it as the pharyngeal recess. Okay, so this would be the larynx. Okay, this is the thyroid cartilage, the lamina of the thyroid cartilage, and this would be the laryngeal prominence. Okay, below to the thyroid cartilage you will find the cricoid cartilage. So this would be the cricoid cartilage. Okay, and this membrane in between the thyroid and cricoid cartilage is the cricothyroid ligament. Okay, and if you can see these muscles, okay, these muscles is the cricothyroid muscle, which is involved in tensing the vocal cord. Okay, the structure below here, this would be the thyroid gland. Okay, now let's look at this model of the larynx. Okay, you can see that the larynx is formed by, this would be the thyroid cartilage. Okay, so this thyroid cartilage, this would be the lamina of the thyroid cartilage, and this would be the laryngeal prominence. And here, this would be the superior horn of the thyroid cartilage, and this would be the inferior horn of the thyroid cartilage. Okay, another cartilage that form the larynx is the cricoid cartilage. Here, this would be the cricoid cartilage. Okay, it's basically has a signet ring-like shape. Okay, because the anterior lamina is thinner compared to its posterior lamina. Okay, so this would be the posterior lamina of the cricoid cartilage. Okay, and this would be the arytenoid cartilage. These pairs of cartilage, we call them as the arytenoid cartilage. And this small cartilage is the corniculate cartilage. And you have another cartilage here. This would be the epiglottis. It's a leaf-like cartilage. And the other one, the cuneiform cartilage, we cannot appreciate it here. Okay. Now, this membrane between the thyroid cartilage and the hyoid bone, we call it as the thyrohyoid membrane. Okay. And this cartilage, this membrane between the thyroid cartilage and the cricoid cartilage is the cricothyroid membrane or ligament. Okay. Now, the cricothyroid ligament also on its superior end, it will form the vocal cord. Okay, in this model also you cannot see it properly, but the cricothyroid ligament, the superior end will form the vocal ligament. Okay, and this vocal ligament with the mucosa, we call them as the vocal fold or the vocal cord. Okay, in this practical, please trying to appreciate the position of this vocal cord in various situation, in deep inspiration, in quiet inspiration, in phonation, and try to learn the muscles that involve in all these situations. Now, station 3, we are going to look at the trachea, the lungs, and also the pleura. Okay, so remember this is the larynx. So the trachea is a continuation from the larynx. So below here, this would be the trachea. And you can appreciate as well the trachea ring. So the trachea ring is important to ensure patency of the trachea. And you can see the trachea is basically a midline structure. Okay. Now in this specimen, you can see we already removed part of the trachea with the bronchi and the lungs. Here you can see this would be the trachea and this would be the carina of the trachea. And at the T45 level, the trachea will divide into right main bronchi and also left main bronchi. The right main bronchi will supply the right lung. The left main bronchi will supply the left lung. Okay, here you can see in this specimen, the right main bronchi is basically bigger or broader, shorter, and more vertical compared to the left main bronchi. Now, the main bronchi will later divide into the lobar bronchi. The lobar bronchi will supply the lobes of the lung. Okay, here in the right side, you can see that the superior bronchi, the superior lobar bronchi divide at the area of the roots of the lung. While the rest of the lobar bronchi, they will divide within the lung itself. Okay. Then the lobar bronchi later will further divide and become the segmental bronchi, and this segmental bronchi will supply the bronchopulmonary segment. Now let's look at this lung. Okay, you can see this lung, it has the apex. Okay, so this would be the apex of the lungs. Okay, and you can see the borders of the lung. The lungs has 3 borders. The first one would be the anterior border. Okay, so this would be the anterior border. Basically, it's thin and sharp. Okay, and this would be the inferior border, and this would be the posterior border. Okay, again, this would be the anterior border, inferior border, and posterior border. And the lungs has 3 surfaces. Okay, this would be the costal surface. Okay, this would be the costal surface that's going to face the costal or the ribs and the costal cartilage. This would be the mediastinal surface. Okay, this would be the mediastinal surface. They are going to facing the mediastinum, and this would be the inferior surface that will facing the diaphragm. Now for the right lung, you can see that it has 3 lobes. Okay, so this would be the upper lobe. Okay, this would be the upper lobe. This would be the middle lobe, and this would be the lower lobe. Okay, while in this specimen you can see the left lung has only 2 lobes. This would be the upper lobe, and this would be the lower lobe. Okay. Now another specimen to show you. So this would be the apex of the lung. Okay, so this would be the mediastinal surface. Okay, and this would be the costal surface. Okay, and this would be the inferior surface. Okay, and the lung will have 3 lobes. Okay, so this would be the upper lobe, this would be the middle lobe, and this would be the lower lobe. Okay, and if you can see, this would be the oblique fissure that will divide the lower lobe from the upper lobe and the middle lobe. Okay, and this would be the horizontal fissures that will divide the middle lobe from the upper lobe. Okay, this is the left lung. So this would be the mediastinal surface. Okay, here you can see on the costal surface, the lungs will have 2 lobes. This would be the upper lobe, and this would be the lower lobe, and this would be the oblique fissure. Okay, that divide these 2 lobes. Okay, let's look at the mediastinal surface. Okay, you can see these structures. Okay, so this structure we call them as hilum. Basically a depression at the mediastinal surface where the roots of the lung will enter and leave the lung. Okay, and if you can see, there are several structures, there are several of the roots of lung you can see here. Okay, the most posterior one, so this would be the posterior border, this would be the anterior border. The most posterior one would be the main bronchi. Okay, and main bronchus. Okay, and the more superior one would be the pulmonary artery, and the more inferior one would be the pulmonary vein. Now we already covered for the lung. For the covering of the lung, we have the pleura. However, in this specimen, we cannot show it properly. But remember, the pleura has 2 layers. We have the visceral layer and also parietal layer. So basically, the visceral layer will cover the whole lung. That's why you can see this lung is a bit shiny. But the parietal layer, we already removed them. Okay, so that's all. Thank you very much.